Hi everyone, welcome back to the channel. I am Drew. But before I get started, just want to say if you hear any noise from the outside, it's because I have all the windows open. It's kind of a nice day. I was just out walking the dog and it's pretty nice. I had to actually zip my jacket down, how warm it was outside, especially in the sun. In the shade, yeah, it's a little bit, you get that little chilly wind coming, a little cold, that little cold breeze. But for the most part, it's pretty nice outside. And because the super wouldn't turn off this goddamn heat, and it's up so high, and the thermostat is not working for where we can control it, which is that's what he said is going on throughout the building. Um, I have no choice but to open the window, or else you will see me here sweating like a pig. So I have no choice. Now, today there was some very sad news. A member of the NYPD has died from coronavirus. Dennis Dennis Dickerson was a custodial assistant who served the department for 14 years as and was assigned to the police headquarters. Died on Thursday at Kings County Hospital. I know Kings County. I've lived near there. I used to live near there. Actually, like probably 2-3 blocks away from where Kings County is. Um, my condolences goes out to the family of Mr. Dickerson, and this would might not be the last of an NYPD member we heard dying, unfortunately due to this coronavirus. And all week I've been hearing about how hundreds and maybe is it hundreds or even thousands of police officers calling out. Just yesterday, they said 10% of the department actually called out in the same day, and looking around these streets around here, I do see the police officers. They are now even wearing masks and gloves at all times. You barely see a police officer without one of those things on. And this is the things that's going on right over here right now. They have blocked off from East Burnside to 184th Street, right over here, a block away from me. They have actually blocked off the streets for the people to walk and I guess get the exercise, which to me kind of defeats the purpose. You tell us to stay inside, but now you give a mixed message now. Oh, go outside and walk on the streets. So you blocked off the streets, which kind of makes, it kind of giving mixed messages, in my opinion. We have 170 members of the FDNY has now tested positive for coronavirus. That doesn't surprise me. Of how widespread this thing is. It's only a matter of time. I recently did a story on a FDNY EMS worker from Long Island who tested positive and seemed like everything was going fine for her. And then she is now on a ventilator because she is not able to breathe on her own. Sorry for all the the stuttering. That's me. I've been that way my whole life. So if any of you wondering, that's my speech impediment, and I do kind of have a lisp somewhere in there as well. So if you find it, please bear with me. I been like this my whole life. I had opportunity to like get the surgery that apparently because my mom used to stutter as well, and she had the surgery where they clipped under there, that thing under there, and by her tongue, by from underneath her tongue, and she doesn't stutter anymore. So, and I turn it down. That's not something I want to do. I think it adds character to who I am. I'm not ashamed of it, and so. And I actually like when people make fun of me. I make fun of myself about it. I don't get mad when people make fun of it. So it doesn't bother me. I wouldn't change anything. So I'm happy with it, so it doesn't bother me at all. My friends make fun of it, and it's funny as there some hilarious jokes my friends make of it. As you can hear, I don't know if you heard that car right there. Uh, the United States now the United States now taking the lead with the most coronavirus cases out of any country, with over 86,000, and New York having about 44% of the overall cases. Yes, and New York is rapidly growing. I'm hearing that Florida, which is hot. I just even checked the weather for Florida is currently 77 degrees. The low for the day was 71, and they're expected to be right behind New York in the number of cases. It might be catching up. You never know, and they keep saying that they suspect that this thing might not, you know, it might not progress as fast in or spread as fast in warmer weather, but Florida already has warm weather, and it seems to be spreading there. So let's see. Like I said, there's just a theory. A lot of them is going, acting like this is facts, like Dr. Oz. Don't trust that guy with a penny. Um, Mayor Bill de Blasio said this morning schools could be closed all the way through May. It's not a surprise to me. The way how things is going, the way how this virus is elevating, and they said the worst is gonna get worse before it even get better. It's already worse. It's just gonna get more worse. And I was not even expecting schools to reopen on April 20th. I don't really expect that to happen. I'm not sure if that's even going to happen, but let's see. I was hoping it would, because I'm not gonna. I don't know if a lot of parents feel like this, and I know I might get some shit. I might get shitted on for saying this, but having both kids at home at the same time, it's freaking annoying. It's freaking annoying. It's a lot of work. I mean, I enjoy my kids. I love my kids. I don't really go anywhere, so this quarantine is not really affecting me as as much as some people I know, because I am not a person that really goes out. I've said this before. I'm not a person that really goes out like that, and but having both of them here at the same time all day is kind of getting on my nerves, to be honest with everyone, because it's my day to day so far since Monday, because he's been home. This is his second week home. He actually, not let me say he. My kids, they love to play with each other, and my daughter wants to do everything her big brother does. So he's trying to do his schoolwork, and I try to have her run so she can actually see, because I'm trying to teach her, because at this point she actually knows her ABC, even though she can't verbally say all the letters as yet, but there's she stay constantly singing the songs or whatever, and she wants to do everything her brother does. So he's on the laptop on the Chromebook doing his remote class. She comes over, she touches the screen, and she wants to play with him. So my day-to-day life is basically trying to keep her entertained away from him, but also I have to be there to help him and guide him, because he's not even though he's 5, he can read a bit. He's not perfect in the reading game as yet. So I have to sit there and read certain things to him or explain, because my son has a comprehension issue. And this is coming from, we had early intervention, I think, where they evaluated him. They said he's smart, but he seems to have a comprehension where he doesn't understand things, and you have to explain to him multiple times. And it's that he doesn't know the stuff, is that he knows the stuff, is the comprehension of it is where he's having issues with. Plus he also has stuttering like myself, and we have him in speech therapy, and So the speech therapy is also helping with the comprehension as well. So and then I also have to, yeah, so he also has to do the video chat. So I'm trying to keep her entertained, keep him do focus on his work, and it's been a back and forward thing. And now she's about to be two, and the terrible two started early. So with my son, he never really had a terrible two. He was terrible. He didn't get terrible until he was three. So I don't know. And then for my daughter, it's been for the last 4 months. She's been just terrible. So I don't know what's going on with that, and it's actually very annoying. Uh, the New York Times put out a video. I don't know if anybody's seen that. I will leave a link down in the description. This is a very powerful video. Yes, the New York Times put out a video taken by an emergency room doctor, Colleen Smith, at Elmhurst Hospital in Queens. The video gives a rare look inside the hospital at the center of the coronavirus pandemic.
All the patients in this room, all the feet that you see, they all have COVID. The frustrating thing about all of this is it really just feels like it's too little too late. Like we knew it was coming.
We don't have the tools that we need, said Dr. Colleen Smith. In the over 5 minute video, you see long lines of people and a refrigerated truck stationed outside to hold the bodies of the dead. Um, it's like, is the morgue filled up to the point where they can't transfer people there? Is it getting to the? This is really getting bad, and this video really shows you what's really going on in these hospitals, or especially that one, which is at the center of this epidemic here in New York State. I have to say, well, I don't know what I'm reading there, but yeah, when I watched this video, it actually run tears to my eyes. To be honest with you guys, I was watching this video and alone, not in front of my girl. I'm a guy. I don't know why I can't. As a guy, I don't know why I can't cry in front of other women. Maybe it's something psychological with me. Maybe it's because years in my country of being told men ain't supposed to cry, or in school when in my country the teachers would beat you. You get hit in your hands with rulers or belts or bamboo sticks, and your friends will make fun of you if you cry. So you have to summon up a way not to cry in front of anyone. So that has stuck with me my whole life. But I was right in this room, just watching the video, and I was watching the video and decided, I'm gonna do it by myself, where I can actually take it in, and I have to worry, but someone seeing me cry or whatever. And I literally shed tears watching this video. It's a very moving video. I'm not gonna show all of it. I think you should go to the New York Times. Like I said, there will be a link down in the description. You can go ahead and watch and hear everything this doctor has to say. There's one thing I did like what she said. She doesn't care if she gets into trouble because it's the right thing to do, and I commend her for that. Dr. Colleen Smith said something that made me think. She said it's America and we're supposed to be a first world country. Yes, that is absolutely true. We America always say America is a first world country. Donald Trump has been pushing this thing, America first, America first. I didn't know that he meant that America would be number one in everything. Did he wanted us to be first in everything? Now we're first. We have the most cases in than any kind of country. We have the most cases, and I think this is due to them downplaying this whole thing. I see some senator or something like that, a governor or something like that, some Republican person who said who basically slamming the mayor or and the governor, I think, for saying that they didn't act quickly, they waited. But the president did that as well. Didn't the president know about this since December, or something like that? And when we had the first 15 cases, he downplayed it, and they keep saying that we are prepared. Now, I will also leave a link down to this Bill Gates, yeah, this TED talk that Bill Gates did, where he talked about a virus, and which sounds more like the like this coronavirus pandemic we're going through. He is very powerful. I suggest everyone watches this video. Back in 2015, he spoke about this. He talked about how nuclear weapons is what he grew up having to worry about, having the shelter and all that stuff. Now these days, that's not what we have to worry about. Is diseases, infectious diseases that can kill us all. And he basically warned and said that they should have the same way they have the army that is ready to go into battle. They should have doctors who are ready to go into battle diseases, and it's very powerful. I'm not going to tell you everything, but I suggest you go watch it. There will be a link down in the description for that video. So I mean, and like I said, what this doctor said is what Dr. Collins Smith said is very true. The conditions are bad. You see reports of people of nurses and doctors having to wear the same gown and mask with patients who have it and patients who don't, who are not infected with the coronavirus. And it's very sad they don't have enough ventilators. And in my last video, I talked about how the governor is trying to say that they do have equipment, and I'm glad this video came out because it seemed like the governor. I'm not really sure if he actually knows what's going on. Maybe he's not in touch. Maybe he's just hearing from his advisors or whoever is telling him these things. But you hearing a lot of stories of hospitals don't have not having supplies, just like the doctors were in the garbage bags in Mount Sinai in Manhattan, and you know, and they said that they've actually been short of supply for almost a year. So the governor trying to make it seem like it's not as bad as it is. He said they still have enough protective gear to last them for maybe a week or two more, but they don't. They don't even have the ventilators. They don't even have enough beds. And in that video, Dr. Colleen Smith mentioned that. She even said that at a point you have, in order for another patient to get a bed, somebody has to die, and it's a sad reality. It's very sad what's going on right now in a country that's supposed to be first world country that don't even have enough beds. And I think the governor and the mayor said this before. New York doesn't have the resources like China did to just build up hospitals and have resources like that. So I don't know what's going to happen because they said this thing is going to get worse. It's going to get worse. A report from the Daily News said Governor Cuomo wonders if coronavirus quarantines may have backfired in some cases. You don't say, Mr. Cuomo. You don't say. A report from the Daily News said, lost my place there. Sweeping statewide orders may not have been the most effective strategy to combat the coronavirus. Governor Andrew Cuomo concerned on Thursday as he weighed plans to restart the economy. Doesn't that sound like what Trump said? He wants to restart the economy. I know you probably hear the ambulance is something that's been happening like all the time. Yes, isn't that something like Trump? And a lot of people shitting on Trump. Like I said before, I'm not politically driven. I really don't care about any of them, Republicans or Democrats. I don't stand on either side. I believe that all these politicians lie, which they do, because to be a good politician, you have to lie. And at this point, It's not even about the politics for me. It's about the policies, and some of them they lie about that too. So I don't trust any of them. But Trump is right at a point where you can't keep everything locked down for what, another year until they get a virus, until they come up with a vaccine. I mean, in my thinking here, and I know my girl probably she doesn't agree with me, but I'm like the flu have killed so far more people every year than this virus is right now, than this virus have actually killed so far. But you don't see anyone doing a lockdown. Where's the lockdown when the flu is killing 16 to 12 or 16,000 people a year in this country? I don't see no lockdown. And yes, there is a vaccine that you can take for the flu, but millions of people every year opt out of doing that. And maybe I'm wrong because I don't really know the statistics of that. How many of those are the people that opt out of taking the vaccine? I remember when my grandmother was here before she went back home to live at her retirement because she was struggling in this country, and over there she had her pension and she's basically a queen over there. So she just went back to her home, her home to live out her retirement in a happy way. So, and she used to opt out of taking the flu shot. I believe her doctors kind of convinced her to do it, let her know because of her age, she's more susceptible to die to the flu, so she should get her flu vaccine. Then I think her job even forced her 1 year to even go ahead and do it, because her job, so she had to end up doing it before, because she had actually came back out of retirement. So it's something she had to do. There's lots of people for years. I didn't take. I'm sorry. I thought my cat jumped in the bed. I For years I didn't take the flu vaccine. Last year was the first time in about since I was 14 or yeah since I was 14 in high school. So I haven't had a flu shot since I was 14. I'm 36 now. 36 is when I finally got a flu shot again. My girl doesn't take it. She didn't want the kids to take it, but I decided no, they're kids and they can die from this if they get the flu. So no, let's just give them the vaccine. But millions of people opt out of taking the vaccine. But where is the lockdown? Where is all this stuff that's going on? Okay, I'm gonna continue reading here. Cuomo said, if you rethink or had time to analyze the public health strategy, I don't know that you would say quarantine everyone. Exactly. You should quarantine the people who are sick, not the people who are not sick. Uh, I'll elaborate more on that. Cuomo has Cuomo has publicly, I don't know why I'm stuttering in that word or can't get it all right. Cuomo has publicly mused about quarantines and how best to eventually restart the economy, eventually restart the Empire State's shattered economy. Yes, New York State's economy is shattered right now. Shattered. There's millions of people out of work right now due to this shutdown, this lockdown that's going on right now. Lots of restaurants are closed. Even in the area right here, I'm not sure that would ever open again. I see some places are just breaking the rules and just keeping their place open because, and I feel for them because I believe clothing stores are supposed to be closed as well. But I see this morning when I was walking my dog, I seen a clothing store that was open. They open. There's a 99-cent store that sells clothes that were open. Now I know I've never been in that 99-cent store, but I know if you sell food, some of them do sell like chips and bread and stuff like that, sodas and stuff like that, so they can remain open. But the ones that don't, my favorite one, my favorite discount store does not sell those things, so they had no choice but to close their doors. This morning I seen the Cricket store, wireless store that was open, but the Metro PCS, or yeah, the Metro by T-Mobile was actually closed. They were not open. So there's some businesses are choosing to stay open regardless of what the rules say, and because it's their livelihood. You're hearing right now. I mentioned this before. Unemployment agency said they have the most unemployment claims in the history since this since starting the unemployment claims since starting unemployment. It's worse than back when we had the recession. It's that bad. Governor Cuomo speculated that quarantines might have played a part in the spread of the disease. You don't say, Mr. Cuomo. You don't say. I don't know if that was the best public health policy. Young people then quarantined with older people was probably not the best public health strategy, he said. The younger people could have been exposing the older people to the infection. I don't know why you didn't think about that before, Mr. Cuomo. Even when the mayor was putting that out there, you shot him down. You said that wasn't the best, the best thing to do. That you don't want to do that. That wasn't the right thing to do. I remember Dr. Oz, that man I don't trust, that's everywhere right now, talking about his show is the headquarters for the most accurate coronavirus news. Yeah, whatever, man. Whatever, man. Whatever. Because you backtrack yourself. You backtrack yourself. You was on the news and you were so against shutting down the city. You were so against shutting a lockdown. You were so against this mass quarantine. I remember you going and saying that that's not the right thing. What are you gonna do? You're gonna shut schools down. You're gonna shut business down. It's gonna be bad. Then when Cuomo finally made the call, oh, I support it. It's the right thing to do. Days before he was so against it. What happened now? Why are you so for it? You backtrack. And that's why I tell people, don't listen to this man. He doesn't support anything. He just go with whatever's going on, just like his show. He doesn't sponsor anything. He says it over and over again. When I did used to watch his show, he said he doesn't sponsor anything. He said he put all the stuff in his show and talk about even the natural cures, which I am a guy who believe in natural cures. That's how I grew up, where things happen and my parents never took me to the hospital. They did the natural at home remedies that work perfectly, no scars, no nothing. So but this my parents still do that up to this day. My dad does stuff like that up to this day, that works without him having to go to a hospital that gonna put him on pills and all this stuff. That's why this country is in the shape it is when it comes to opioids. But yeah, this man does all this stuff on his show, and he always say he doesn't sponsor anything, and he knows why he's doing that, because if anything goes wrong, he doesn't want to be sued. So like, how can you trust someone who's telling you to do, basically telling you to try these things, but doesn't want to sponsor it, doesn't want to put his stamp of approval on it, because if it takes something go wrong, he doesn't want to get sued. That's what he's doing. He's protecting himself, and he's probably not even trying any of these things that he's telling us to do. I doubt he's trying all of these things. I doubt he's doing all of these things. So why would you do that? Why would you follow someone? I mean, my girl was she followed him on some diet pill that made her sick. She literally got sick. I think her asthma started acting up and all that stuff that she had to, and it's one of these over the counter drugs things, over the pills, the diet pills nonsense. I'm like, do the work and do the natural way, or just live, just be happy and just live the way you are. Screw it. That's why I don't trust this man. He doesn't, and that's why Congress shitted on him, because over the same reason. Over the same reason. Now, as far as the governor saying that young people could have been exposing the older people to the infection, what do you think? In a lot of cultures, people live with their parents, their grandparents, for their entire life. They don't move out. I know that to be true in some black cultures, some Latino cul- cultures where people live with their parents for their entire lives. They take care of their parents. I have a cousin who got married, and that's what she's doing, taking care of her husband's parents or his mom, something like along those lines. But there's a lot of cultures that do that, and telling and you quarantining, telling people to stay inside who may have already been infected but not showing any symptoms, as you say, asymptomatic. They're basically the carriers. They're infecting their household. Instead of telling people, well, you're sick, you stay away from the kids. You tell somebody, okay, well, you're positive to go stay in the home as long as it's not bad. You don't need to be in the hospital. Which I understand the hospital don't have the resources to accommodate millions and millions of people, but they should have been a better plan in place from the get go, and they waited too long. All of them, both Republicans and Democrats, I believe, waited too long. The state waited too long. The president waited too long, and there's a lot of blame to go around. But right now, we just have to deal with things, and you know, get things back to where it was, or try to. Is I doubt it's going to get back to where it was before the shutdown, before all of this even happened, because now there's a lot of people who's not going to be able to get jobs. I mean, you have a lot of shipping jobs that's available, and delivery jobs. But how long? When the dust settles, do you actually believe these companies are going to keep all of these new hires? Do you actually believe that? Because when everything settles and all the hysteria and all the anxiety and all the craziness is over with, oh my lord, people are making noise upstairs, and all this stuff is over with, what do you think is going to happen when all these online orders stop coming in like that? When all the delivery calls stop, what do you think is going to happen? They will not need all of these people. So all these people will be laid off and back and go, and which will increase the unemployment situation even more, even greater. So that's what's going to happen. So I can see this people not being able to find jobs for a long time, for a long time. And like I said, I believe this was kind of a stupid move, and I could understand why they thought it was the best thing to do. And I guess they were looking at what other countries are doing, and they decided to do that. I think I seen a report of how Italy was. Is it Italy or Germany, something like that? I'm not really sure. I can't be. Don't quote me on that, please. But there was a report last night on how, on the news that I seen, that how in one country that they were sending the alerts. If you get those alerts from the when somebody's missing or whatever, a child is missing. Yeah, you get one of those alerts telling you who and where that person lives that is being confirmed to have the virus. So you would know to stay away. It's kind of like the sex offenders list for the COVID-19. So you would know who have it, and to stay away from. And so, but in America, we can't have things like that. You cannot disclose someone's medical issues unless they would have to do that themselves. So, or they would have to give permission for that. So that's how it is here. And I don't know what life is going to be like in the next 6 months or the next year, the next 2 years. I was actually trying to find a job myself before this whole thing happened. I actually had a job lined up. Oh, I just had to get my driver's license. I got the permit. I just needed the license, and that was something I was planning on start on going to a driving school. And then this whole thing just happened, and right now I'm basically here with watching my kids all day. Um, my daughter was actually supposed to start the early learning program when she turns 2 in July. She's supposed to start in July, which would have been awesome, and that would have been the perfect time for me to head back into the workforce. that's probably not going to happen at all right now because of everything that's going on. That's probably not going to happen at all. So who knows? I'll probably be stuck in here for another with my kids. I don't want to use the word stuck because I love my kids, and I mean when I have one or the other alone for most of the day, it's pretty okay. But I won't use I know I shouldn't have used that word stuck because like I said, I do love my kids. They're the world to me. It's just that when they're together, it's like they're trying to kill me. That's how it feels. Like my kids are out to get me, and it's stressful. And then too, I hope all of this stuff is made. All this anxiety and stress that's upon everyone right now. That all that stress is bringing your immune system down. That's gonna affect your immune system. Stress affects your immune system, which means this thing can hurt you more than it would. And it's now I'm really understanding why a lot of people choose to not be stressed, not worry about the social distancing nonsense. I mean, it's not nonsense, but I'm just saying of what their mentality is because I've heard some of them say it. And in some cases it is they want you to stay away from your family that you may have even live in your home with, which makes no sense. Why am I with her inside, and all these people, my relatives, and then we go outside, we gotta walk separately? That kind of 6 feet apart or 6 feet or more apart. That kind of don't make no sense. But some people feel like this is just foolish, and they're just gonna go ahead. They're just gonna go ahead and live their lives and not even stress about it. And I think that's in a way a good thing because you're not stressing, you're not bringing down your immune system to being attacked really hard by this thing. It's and I'm a person. I'm not stressed by it at all. To be honest with anyone, I'm not stressed. But I'm not stressed, but I do sometimes worry, which is also stress because I sometimes do stress for my girl because if she can't get this thing, she has a history of asthma, even though it's pet allergy induced, it's still asthma. And like the FDNY EMS worker who had her asthma under control, this thing hit her so hard to the point where she can't breathe. In my mind, this coronavirus uses things that you already have, whether it's cancer, whether it's diabetes, whether it's asthma, or whatever else you may have, or like the old man that I met yesterday that's on the dialysis. It already uses any kind of health problems you may have against you. And that's how it's killing you with these underlying issues, stuff that you have already had pre-existing. It just uses it. It uses that to tear you down, and that's what my mindset is about this thing. Um, you know, and I just wanted to get a few things off my chest about what's really going on. That's it for this video. Please like, share, subscribe, leave your comments down below. Follow me on my mind is going blank right now. Follow me on Instagram and Twitter at talkwithme36. Until the next video, which I'll have a lot more, probably more updates as it's coming out daily, hourly. I will have more news. Until then, see you guys in the next one. Peace out.